My name's Jake, I study sports therapy at Edgehill University. I think I've always been interested in sport, especially with my dad pushing me to play football, cricket, rugby, as many sports I could play at a young age. And then throughout my GCSEs, I started to become interested in the human biology side and then the anatomy and physiology side of PE. I chose this particular course because it provided me with the knowledge of specific therapies to work with professional athletes. We study a wide range of subjects such as anatomy and physiology, which makes up a massive part of this course, kinesiology, which is about the physics, about how we move, exercise therapy, rehabilitation, strength and conditioning, soft tissue techniques such as massage, trigger points, and then we also do mobilisations of the peripheral limbs and the spine. We study in lectures, seminars, but the main bulk of our time is taken up in practical sessions where we actually physically apply the techniques that we are taught in the modules. We are assessed by practical exams. We also do written exams and written assignments as well. We are taught by qualified clinical staff who all have expertise in their specific fields. For example, some of our staff have worked at international level with the FA and Team GB. Another benefit of the staff is that they are all research active. For example, we have staff active in the areas of GPS systems, kinematics and soft tissue work. The staff are really supportive on this course as each year we are assigned a personal tutor where we have regular meetings about upcoming work, deadlines, but then they'll also put things into perspective so they make sure you enjoy university life. The facilities on campus include sports therapy clinic rooms, which are fully equipped. This is an important part of our course, and then this is where we also have the external clinic patients come into, so it's important to have this professional environment that we would see in the real world. We also have access to Sporting Edge at the Sports Centre, where we use the Sports Centre and the 3G pitches for modules such as exercise therapy, rehab and strength and conditioning. I have benefited most from the rehab and the musculoskeletal lab. These are fully equipped rooms with high-tech kit so that we can take our learning from lecture situations to practical situations to ensure that we are giving patients the correct coaching techniques. There are a lot of opportunities available for us on this course. We have external placement, which is conducted with semi-professional and elite teams in the North West region. Also, we have many guest speakers coming in to give us lectures about what it's like to work in the sport therapy industry. I think the best thing about this course is that it opens up so many avenues upon graduation. You can go on to do master's courses, or you can graduate, become a graduate sports therapist and then open up your own business and work in a clinical environment. My plans after graduation are to study a Masters of Research degree and potentially a PhD. Throughout these 3 years, it's grown on me that I've enjoyed the research side of this course, so I want to apply this to my future. My course highlight is being on placement with St Helens Rugby League team. This is because it was my first real experience with working with professional athletes and an elite level club. I really enjoyed this because the players and staff were really welcoming and inclusive, so I felt a part of the team. This has really given me an insight to what being a graduate sports therapist is like in professional sports. The 3 words I would use to describe this course are enjoyable, engaging and memorable.